KFSR at CMAC present the Central Valley Ledger, a public affairs program featuring stories from all over the Central Valley with Sevag Tateosian, 90.7 KFSR.
Welcome to another edition of the Central Valley Ledger. We're recording out of the beautiful downtown Fresno studios of the Community Media Access Collaborative, Fresno and Clovis. Our guest this week is Shantay Davies-Balch. Welcome to the program.
Thank you so much for having me.
So you are the founder and the president of the Black Wellness and Prosperity Center, correct?
That is correct. I am so excited to say that.
Tell us what this center is.
Absolutely. So first, let me explain what Black means. So Black means belonging, love, affinity, community, and kinship. And the reason that's so important is because if we look at our population here in Fresno, there's really a need to sort of unify and bring together and really amplify the needs of the Black population. We're not a very large piece of the population, and so in many ways, the population tends to sort of fall through the cracks. And so, we have really a number of phenomenal folks who are interested in improving health outcomes and closing disparities. But sometimes there are unintended consequences, which is when you are not a majority of the population, that population tends to fall through the cracks. And so that's really my goal, is to really amplify the voice of the Black community and ensure that we have a really systematic and intentional way that we are identifying and looking at ways to solve problems or challenges or barriers that we have in the Black community specifically.
So talk about, this is a loaded question, but talk about some of these barriers and how we can break through these barriers to ensure that our community is well.
Absolutely. So thank you for asking that question. So let me start by the overall long-term big picture wow vision for Black Wellness and Prosperity Center. So the overall wow vision is that in Fresno, we will have literally a Black utopia complex that encompasses everything that Black women and children need to thrive. And that really goes from everything from comprehensive maternal child health education to high-risk OBGYN services. And I want to revisit the phrase, high risk later on in our talk. But to integrated care with, paraprofessional support, case management support, having a midwife, having a high-risk perinatologist on hand, and really basically just having everything in one hub in one place, and really being able to promote and really guarantee, if you will, continuity of care. And I kind of want to explore that phrase of continuity of care because first, I want to say that regardless of your race, ethnicity, across the U.S. and in Fresno County, everyone has a really difficult time navigating our healthcare system. It's really complex. Regardless of, your socioeconomic status, whether you're high or low or in between, whether you have, publicly guaranteed insurance like Medi-Cal, or whether you have, employer-sponsored, it is really difficult to navigate our healthcare system. But something that we have found is that when you are a person of color, and for me, I will speak specifically from the female perspective of navigating the healthcare system, there's an additional barrier. So women of color, and then specifically when we break it down by what our disparate outcomes are, Black women in particular have a really challenging, difficult time to navigate the healthcare system. I will kind of backtrack just a little bit and say that we have an indigenous population. We have, our Hispanic population. We have Native American populations. And it's really all difficult to navigate for everyone, including our Caucasian population, which in simpler terms, I'll just say our white population. And then going forward, I will also just say our Black population versus African American. That's too many syllables.
One of the things you wanted to revisit is high risk.
Yes.
Let's talk about that right now, because we hear that term, high risk, all the time. And some people may look at it differently, but in your opinion, how do you define this high risk concept?
Yes, that's an excellent question. So let me start from a higher level and just say that of all of the developed countries in the world, and I want to reiterate what I just said, of all of the highly developed countries in the world, the U.S. is one of the most developed. But the U.S. is also one of the most dangerous places for women to give birth, regardless of your race and ethnicity.
Okay.
That's really scary to think about. Just reflect on that just for a moment. Of all developed countries, and we spend about 19% of our GDP on healthcare services, we are one of the most dangerous places to give birth.
That's pretty scary.
Okay, that is beyond scary. And then I want to follow that up, though, with saying that although we are the scariest place in the U.S. to give birth, California is the safest place to give birth.
Interesting.
In the U.S., wait for it, unless you're a woman of color.
Wow.
And specifically, unless you're a Black woman. So here's what that means. Black women are 3 to 4 times more likely to die from a pregnancy-related cause than all other racial ethnic groups. And the Centers for Disease Control, CDC, estimates that 3 out of 5 of those deaths are preventable, right? 3 out of 5. And just really quick, I feel like there's a really relatable example that folks will identify with. So, just like a year and a half ago, we had this sort of situation come up with our tennis superstar, Serena Williams.
Yes.
Who almost died in childbirth. And, she kind of spoke up. She tried to engage with her physicians, her care team to say, something's wrong, I don't feel well, something's going on. And she is what we would consider an extremely well-resourced Black woman. So imagine...
Money isn't a problem for her.
Yes. So consider an extremely well-resourced Black woman who's trying to speak up about what's happening to them versus a very low-resourced Black woman who's trying to speak up. And if we have an extremely high-resourced woman who almost dies, imagine what the implications are for someone who doesn't maybe have the same literacy level or information or support network. And then we come back to 3 out of 5 of those deaths are preventable.
Do we know, I don't mean to put you on the spot, but
no, absolutely not.
That 3 out of 5 number is
scary.
It's scary because, here we are in this developed country where, you don't think of those kind of things unless guests like you are bringing it out to the front. So what's the reason for that? Do we know? Is it the physicians not listening?
Well, that's a really complex question. Oh my goodness. So the answer to that is you're right. The rate of Black maternal mortality, it's very complex. as is the rate of Black infant mortality and Black preterm birth. But there is something that we do know. We do know that Black women do not have like a predisposition. They do not carry a genetic, chromosome that says you're going to die sooner. You carry a gene for preterm birth. We know that that is not scientifically feasible. It's been disproven multiple times across the institutions that we respect most. However, what we do know is that there is an increased need and acknowledgement to look at the social environment of Black women and what they experience in real life. So we have many of our populations of color that have experienced, less than optimal situations, experiences, treatments in the U.S. However, there is not really a relatable situation that we can compare to our Black population that continues to persist in terms of where we are right now in 2020. And so that's a really fancy way of saying that what our leading institutions, including Harvard, Stanford, Johns Hopkins, have said is that it's really institutional and structural and societal racism that plays a huge, huge role in the outcomes of Black women and their babies' infant mortality. And here's what that means in really layman's simple terms. That means that as you go through life, you experience these different types of chronic stress situations. And what we've been able to prove scientifically is that these chronic stress situations have a direct correlation, a direct causation, not correlation, but causation to adverse birth outcomes, meaning that we have scientific evidence that says that chronic toxic stress changes your biomarkers and then your health outcomes are different. We have in Fresno County specifically, we know, for example, in 93706, West Fresno, for example, the particulate matter is much higher there than it is in other areas. And there's a direct correlation between high particulate matter and pollution to preterm birth. And preterm birth is really important to discuss because it's the number one indicator of infant death before age 1 in the U.S.
At the health department, my day job, what pays the bills,
Yes.
we talk about this.
Okay.
Certain zip codes in our town, people are dying younger.
Yes. It's
That's a
about
problem.
20 years younger.
That's a problem.
Right.
For me to live in a certain area and not live as long as others in a certain area, that's a problem.
Absolutely.
And it touches on what you're saying about what you're telling us about.
Yes.
So so this is going to be a tough question again, but solution. Let's talk solution because
Absolutely.
we're aware that the issue is out there. So how do we come together and solve this problem?
Okay.
Or maybe take a baby step towards
Absolutely.
solving this problem.
I love that question. It's a really important question, actually. And I think also it's a complex question that has many answers. And let me just sort of quickly address 3 quick solutions, if we will. So 1, I feel like there's an individual solution, which is, I'm aware now that this is an issue. And so now how do I reflect and build my self-awareness to hold myself accountable as far as what I need to do? And I'll give a specific example of that. So we know, for example, if we look at Southwest Fresno, that is highly under-resourced. And if you look at the amenities, they do not look the same as North Fresno.
Yes.
Right? It's blight all the way around. So a specific example of that is we know that in maternal child health outcomes, in maternal mental health, decreased depression, there is a high correlation of having green space and trees as part of improving maternal health outcomes. So if we look at the zip codes that have the worst outcomes, which is in West Fresno, Southwest Fresno, or sometimes what we refer to as the West Side, there are no parks there. There is no green space, right? So at an individual level, it could be a policy engagement. In other words, voting for things that could potentially increase access to chronic stress reduction, neighborhood amenities, finishing our neighborhoods, right? Increasing green space, the number of trees, increasing the number of parks. Because again, from our leading institutions, we see scientific evidence and data that says this actually makes a huge difference. So that's at an individual level. From an institutional level, for example, we can look at some of what we call the social determinants of health. That's a fancy public health word for basically—
We use that at the health department.
At the health department, basically for just saying, what's the access? What are the living conditions? How much control does the individual have over things like social mobility, for example, access to education, equitable education, and I think that word's really important, equitable education. So then from the institutional level, we can do things, for example, around, let's take Fresno City College, for example, and what Dr. Carol Goldsmith has committed to, which is, for example, committing to building a satellite Fresno City College campus in Southwest Fresno, because we know Southwest Fresno has the least access. So we want to increase access to get to those locations that can help us increase our level of education, right? And then so the other thing is it's located in a hub or a place, if you will, where folks in those communities can actually get there. And then Dr. Goldsmith has also committed to increasing the number of CTE programs that directly impact childbirth outcomes. And what I mean by that is if we look within healthcare specifically, we know that we have an affinity problem. We know that there's lots of research that shows that if you look like me, whether you're Armenian or Hispanic, or if you identify as Southeast Asian, Black, African American, that you will have a better health outcome if someone is serving you that looks like you. And so by locating this campus in Southwest Fresno, we are providing an opportunity for affinity education. Dr. Goldsmith has specifically indicated that she will prioritize 2 areas of healthcare that impact the Black African American community. And now the next step is to be able to help build the infrastructure and the capacity for the Black African American community to be able to assess those 2 new health priority areas. And that's really important. So, and then I'll say that the third thing, I said there were 3 things, right. I'm on the second. Yeah. So the third thing is what I feel is actually, let me say 3A and 3B.
Okay.
Okay, so I would say that 3A is that as a society, there's a real need to remove the blame from the Black mother, which shakes the finger like you, why are you having these babies, that are low birth weight or preterm? Because there's not a control, if you will, of external factors of when you go to the grocery store, when you go to get gas, when you go to your doctor's appointment, right? In the public health behavioral model, there are really the public health, the clinical care, it really equates for like 10% of what really happens if you look at the
percentages.
Right, if you look at the percentages. And so that's a really low, if you will, investment area, meaning that public health is doing a really great job, and public health is really focused on things like immunizations and
So you're telling, that's my day job, and that chart that you're talking about, I've got it.
Yes.
It's a breakdown of percentages of what makes up overall health.
Right.
And clinical care
is a very small percentage.
Contrary to what the average person thinks, clinical care is a small percentage compared to all these other factors.
Right, like behavioral and neighborhoods, and finishing neighborhoods. And so that's what I would love for our listeners to understand, that it's not about always. So we do need quality care within our clinical settings, but that is not the end all be all.
Something as simple as dogs running loose.
Yes.
To a mother who's pregnant.
Yes.
Trying to get from the car or somewhere
or the bus stop
to
or
the
something.
House.
Exactly.
Something as small as dogs running loose will impact the psyche.
Right.
Will impact that mother.
Right.
In a negative way.
In a very negative way, and even in her interest in being willing, right, to access services outside of her home, or being even willing to access public transportation, for example. And I love that you have a public health background.
I'm telling you, and I'll even take it a step further. We have a park down the street from where I live, and sometimes I don't feel comfortable going to that park.
Right.
So even if the parks are there needs to be something that me as a dad of 3 kids will say, I feel safe going to that park.
To access the park.
So it's not just, the answer isn't, oh, there's a park in your neighborhood. There is.
Right.
And I can walk to that park. Right. But guess what? If I don't feel safe in that park for whatever reason, so we need to make sure that those things are there so that people like me can take their kids to the park so they can run around and get some exercise. So there are a lot of factors that make life easy or make
more accessible, healthier, more accessible. I really love actually that you use that example of loose dogs, actually. I feel like it's almost a deprioritized safety issue that we have. And I just actually want to speak about something specific. So right now in West Fresno, there's a coalition of leaders who are very focused on reducing Black adverse outcomes in terms of infant mortality and preterm birth. And, you know, that includes myself. It includes our champions at West Fresno Family Resource Center and our community advocates like Dr. Venice Curry, UCSF, and First Five, Fresno EOC, and then also UCSF. And so we actually have just recently launched something called a Best Babies Zone. And we are extremely excited because we are only one of 2 prestigious designations in California and across the nation.
Congratulations.
Well, thank you very much. We worked very hard to get here. But across the nation, we are one of only, and this is approximate, don't quote me, about 11 designations.
Wow.
But basically, the idea of a Best Baby Zone is to really work toward reducing preterm birth and infant mortality for the communities, for the racial, ethnic communities who are impacted most, in a way that addresses the issue outside of a clinical setting, because going back to public health, we know that our clinical setting is really a very small portion of what happens before you even get to the doctor. But it's really addressing the neighborhood level access points and how well developed a neighborhood is that really impacts what happens. So we have this Best Baby Zone, and we are in the infancy stages of launching in West Fresno. We're focusing on 3 census tracts that have the most adverse outcomes. And just for those folks who love data, those are census tracts 7, 9.02, and census tract 2. And then census tract 10, we've designated as sort of the overall sort of hub to position all of the work to happen in. And so you mentioned something about feeling safe in your neighborhood. And we've been able to engage at this point through different activities that have leveraged or been a continuance of something, likely almost 1,000 residents in Southwest Fresno. And one of the themes happens to be around neighborhood safety and loose dogs. And so I want to actually give props right now to our Fresno County Department of Public Health, specifically our Maternal Child and Adolescent Health Division, which is spearheaded and managed by Rosemary Ron.
Yes. Who
has really taken on the leadership role in sort of engaging with, the SPCA and animal control, and sort of figuring out the whole Fresno City versus Fresno County and all of those sort of intricacies that kind of like impact safety and access. And so we're working on that. That's a solution. We are working on that.
So we are running, believe it or not, we're running out of time, and you and I can talk for hours about this stuff, because I feel like working at the health department, whereas my day job that pays the bills.
Yeah.
We have a view very similar on stuff.
Right.
But for people who haven't seen the world in our lens,
okay,
what's your advice to them? Because there are people out there, and I'm not criticizing them, but there are people out there that are in a bubble, and they know the bubble and nothing else outside of the bubble. What advice do you have for someone that doesn't see wild dogs, that never has had a car breakdown when they're going to an appointment, or taking the kid to school and their car breaks down, and now there's that added stress in their life of, not only do I have to take the kid to school, but my car's broken down, I may not have money to pay the bills. There are challenges that people are facing in this society that others may never have faced.
Right.
What advice do you give for someone who's in that bubble?
Well, thank you for asking that question. I actually think that it's really important because, so first I want to acknowledge the fact that we all have different experiences, and our experiences are our own, and our experiences are neither good or bad. None of us can control what type of family or neighborhood or socioeconomic status that we were born into. And so I would say that all of our experiences are relevant. And the first thing I'll say is, I don't know anyone who doesn't love babies. I mean, it's really simple. We all love babies. Like, it doesn't matter, like where you live or your zip code or, your education or how much money. We all love babies. They're so cute.
They are.
They're just so darling. Yeah. So I want to just start with that we all love babies. And we all want our babies to be healthy and to thrive. And I think we all recognize that our babies are our future, right? Okay, so let's just start there. We all love our babies. And then second, let's start with the fact that our experiences are our own, and we know only what we know. So if you're probably listening to this, right, you probably have an interest in learning or understanding more what your role is in this realm of what we call, equity or being inclusive. And so my advice, as you said, was to first, one, celebrate your position, whatever it is in life.
There's always worse.
Whatever your position is. I mean, we can all, we are champions, we're decision makers, we're advocates, we are lived experience, we all have a different role. And so it's first to acknowledge what your role is, and then it's to really understand where your role can best help really facilitate movement and optimal outcomes for all babies, but also for decreasing the disparity. Because, in Fresno, we have 14.9% of preterm births among Black women compared to, like 8.9% for white women. That's not okay. No one thinks that's okay, right? And so going back to your question is, okay, so what do I do? What's my role? So I would say the role is to understand, one, how societal views and decision-making impacts our communities that really experience the most disparate outcomes. So for example, things like green space, parks, trees, understanding the connection between adverse outcomes and particulate matter, simple things. So that's what I'm really saying in a simple way is, don't just take for granted what someone says politically. Do your homework and really understand how like a specific measure will impact something that's important to you.
Perfect note to end. Definitely we want you back to talk about some other things that are going on, but I appreciate your time and educating us on all the incredible things you're doing.
Well, thank you for saying that. I really appreciate being here. Thank you for inviting me. I would love to come back 5 times, maybe 10, because I feel like really this issue, it's so complex and it's so broad. There's so many things that need to be addressed, and I think there's so many different ways that we can engage our community and really make everyone actually in our community feel valued and have a place in this conversation and help folks really understand what their role is, because there's a role for everyone.
Thank you for that. Excellent advice.
That's
all for this edition of the Central Valley Ledger. We hope you enjoyed the program this week. Thank you to our technical director, Paul Starcevich, who made us look and sound good. Tune in next week to a new edition.
KFSR and CMAC present the Central Valley Ledger every Sunday morning at 11:30. For a complete program schedule, visit kfsr.org.